side. Okay, the head is inside, and then you're supposed to push the shoulder down. Okay, in depression. So there will be stretching at the upper trapezius. Okay, you're supposed to push the shoulder down, and which will cause stretching at the upper trapezius. Okay, if you're not getting it. Okay, now for the biceps and for latissimus dorsi, you do that. For biceps, what you're supposed to do, the action of the biceps is come to the edge of the couch. As you see, the biceps also causes flexion at the shoulder. It also causes flexion at the elbow. It also is a chief supinator. So we are supposed to make the patient's forearm into pronation and elbow into extension, and then the shoulder into extension. So it will cause stretching of the biceps. You are getting stretching here. It will cause stretching of the biceps. Understood?
Yeah.
Okay. Now coming to the triceps, the elbow is bent because it will cause extension at the elbow, at the shoulder, and extension at the elbow, right? So I am supposed to bend the elbow and bring the elbow back above the head. Okay, above the head, and this will cause stretching to the triceps. Okay. Now for the wrist flexors, I will simply come to the front view. Okay, first stabilize the elbow. Okay, keep it in slight abduction. Okay, and then bring the fingers up and place it on your thigh. And then stretch it. Okay, because you will not be able to interlace all the fingers. Yes, for finger wrist flexors. Okay.
Doctor, what time you
Stretching
do?
has to be
30 seconds.
10 seconds.
10 seconds.
10 seconds. Okay. And for wrist extensors. Okay. And then you can give stretching to the lumbricals also, because lumbrical action is flexion at the metacarpophalangeal joints and extension of the interphalangeal joints. So you can flex the interphalangeal joints and extend the interphalangeal joint, which is going to cause stretching to the lumbricals. Okay, lumbrical stretching. Understood?
Yes.
The action of the lumbrical is extension at the interphalangeal joints and flexion at the metacarpophalangeal joints. So you can flex the interphalangeal joints and extend the metacarpophalangeal joints to cause it stretching to the lumbricals. Understood?
Yes.
Okay. Coming to the hip, okay, knee and ankle. Major muscles are your gluteus maximus. Gluteus maximus, how we are stretching is, we are just placing the other limb down, okay, stabilizing the other limb, telling the patient to do this way, and just pressing the knee towards the chest, okay, which is going to stretch the maximus. Okay. Now stretching the hip flexor is very, very important for a physiotherapist, because hip flexor tightness and hamstring tightness, many patients have. So you need to be very expert in stretching the hip flexors. Okay, so how we are supposed to do the effective way of stretching hip flexors is using the gravity itself. Okay, so what I'll do is, the best way is, come to the edge of the couch. Okay, come a little bit more. Hold me, and bring your hip down and take it down. This is the best way of stretching your hip. So I am stabilizing the patient. Now bend your knee. No, bend.
الوها
Take it in. Yeah. No, take it in. No. Take it in.
شوفها تحت
Take your ankle in.
ايه
Yes. So this is going to stretch him little more. This is going to stretch the rectus femoris, because the rectus femoris is will be a muscle here as well as the knee. Okay, there is another way of prone. In prone line we can give stretching to the hip flexors, as well as in side line we can give stretching to the hip flexors, but it becomes difficult to stabilize the pelvis when it is in side line position. Okay, now giving stretching to the hamstrings. Okay, what we are supposed to do is we are supposed to bring the couch down so that I can come off the couch. Okay, now I will be stabilizing the other limb with my limb. Okay, relax. See, it's painful.
Yes.
Now,
Yeah.
okay, and I'll bring it up this way, and then stretch it slowly with leaning forward. Okay, so this will stretch this is stretching his hamstrings. Now what I can do is I can medially rotate, laterally rotate, or medially rotate. So let's see, if I am laterally rotating, okay, it is going to stretch biceps femoris more, and if I am medially rotating, it's going to stretch semitendinosus and semimembranosus. Okay. Now for the ankle, we have triceps surate. So there is gastrocnemius, which crosses the knee joint as well as the ankle. There is soleus, which crosses only ankle. So if I am stretching soleus, so I am supposed to keep the knee bent, okay, and then stretch it. Okay, stretching is by holding the calcaneum and with the forearm pressing onto his forefoot, and then pressing it towards the shin. Okay, and this is going to stretch your soleus. So if I want to stretch gastrocnemius at the same time, I just have to extend the knee, and it will stretch the gastrocnemius. Okay. Now for stretching quadriceps, I need to make the patient position prone. Okay. In prone position, what will happen? The knee will be bent. Okay. This is going to stretch the quadriceps. Now if I want to stretch rectus femoris, I just need to lift the hip up, and it's going to stretch quadriceps as well as rectus femoris. Understood? So can you practice these two, and you finish all these two, and then we can start the mobilization.